Welcome to the Three Ways Telehealth Drives Revenue Post-COVID. First, let me introduce myself. My name is Ryan Roush, and I am the VP of Marketing with Mend. I'll be moderating today's presentation. One housekeeping item before we jump in. There will be a Q&A session at the end of today's presentation, so feel free to submit any questions you have during the presentation, and we'll attempt to answer as many as we can. Now, with that out of the way, I'd love to, it's my distinct pleasure to introduce Matt McBride and the CEO of Mend, and Stewart Gandolf, the CEO of Healthcare Success. Take it away, Stewart.
Great. Hi, Ryan. How are you today?
Wonderful. Thank you. Thanks for joining us.
Great to get started. Hi, I'm Stewart Gandolf. I'm CEO, as Ryan just mentioned, of Healthcare Success. We are an integrated healthcare marketing agency. And so a lot of our attendees today are probably frequent blog readers of our blog. And of course, I have a whole new audience of people that we're meeting through Mend. Super excited to be here. And I think telehealth is such an important topic. And I think it's fundamentally a part of marketing a hospital or practice. It really is the future. So this is a topic I personally love, and super excited to be here. So thanks for inviting me.
You got it. Thank you. And now, Matt, I would love to have a little bit of background on you, and what Mend's all about.
Yeah, thanks, Ryan. Matt McBride, CEO and co-founder of Mend. I'll keep it brief so we can get into all the content that we have prepared for everybody today. But basically, Mend is an entire patient engagement platform. So whether the appointment is virtual, whether the appointment is in person, we have telehealth, reminders, payment, digital forms, messaging, an AI, a patient attendance predictor. So one partner, one integration can leverage it over and over and over again for all of your patient engagement needs. We've been doing telehealth for a long time, and that'll be the focus for today. And we've got, I think, a lot of cool things to share and cool ideas that be exciting to get into.
So I'll go ahead and start on the agenda. So today, we're going to start off talking about what's happening with telehealth today and post-COVID, kind of how we get here, or how we got here, to set the context. Some of the big questions people have as we talk to providers, hospitals, is about regulation, reimbursement. Those couple of things are really important. So I think it's important to get Matt's take on what's happening there. There's certainly, everybody wants to avoid making mistakes. You know, one of my big things is to learn from the mistakes of others before you. So we'll talk about some of the things that can happen with telehealth. And then we're going to talk about revenue generation. And, you know, we'll be doing a series of content about telehealth in the future. Today is, you know, sort of the high level big picture, and we're going to touch on some of those and even have a case study. And then we'll make sure we have some time available for Q&A as well. So today, and in terms of telehealth, I often talk about telehealth as, you know, when I'm talking with peers or colleagues about where we are, and I call this period right now the dawn of telehealth 3.0. So I would argue that telehealth 1.0 was the decade or so of preparation up until last year. So telehealth has been around for a while in various forms, maybe more than 10 years, and progress was slow, right? There was unique rules with Medicare to be reimbursed, and there were very few use cases, relatively speaking. So there was concern about reimbursement, which is sort of a non-starter in healthcare. If you can't get reimbursed, it's hard to get people excited about implementing something new. And then number two was the whole HIPAA issues. So those two things were enormous barriers. So for the early days of telehealth, it grew, but it certainly hadn't been embraced. And there was a fear on the part of providers. There was a fear on the part of patients, at least some patients. And so it was kind of an artificial lever pushing it from really blooming. Then, of course, COVID came, and it's the amount of adoption in telehealth in various forms, including simple, Zoom calls or Skype or FaceTime. Any form of telehealth just exploded on the scene. due to COVID. And obviously that was a good thing. We had to be able to see patients safely without increasing the pandemic. So things really took off. And in fact, I heard hospital or health system people say they got more done in 2 weeks than the entire previous 10 years in advance. And suddenly, instead of going from 0 telehealth patients, they were doing thousands each day. So today, why I say this is 3.0, as the pandemic hopefully wanes, we're going to see the things change, right? So the surge is over in terms of the initial adoption, but now it's like looking at the long haul. So in this section, then we're going to talk about, how the technology got adopted. We're going to talk about what patients think, what doctors think, and a little bit later, Matt's going to be talking about where it's headed. So this is a model that I love. I still remember this from Marketing 101 years ago. This was invented in the 60s. It's called the diffusion of innovations. And the diffusion of innovation talks about any technology adoption from consumers. And there's a very 100% predictable curve here that happens over and over and over again, from the transition from 8 tracks to cassettes to DVD or CDs, and movies from VHS to DVDs, smartphones to flip phones to smartphones. And so what happens is people adopt technology. What we were seeing is this time period gets condensed faster and faster in our world. People are going through whole product life cycles in a couple of years, where it used to take a decade or two. And so you may have heard these terms before, but there's actually a model behind it. So the innovators are the people that are willing to try anything. I'm probably in the early adopter category, where I let the other people get, the arrows in the back as the pioneers. I love being new. I love having the newest stuff, but not exactly the complete newest stuff. So I like to see kind of where the winds are blowing. The early majority is the next phase, late majority and laggards. The laggards are still trying to get their mind around the smartphone today, whether they should get one or not. And so that's really very, very common. You can see the market share increases over time. So this is the natural order of things. But again, telehealth, we flip over to the next slide, was artificially kept down by reimbursement and by the HIPAA issues. But you can see what an explosion it happened when HIPAA and HIPAA issues and reimbursement issues, that gate was open, right? It was just a massive explosion during the early days of COVID. And you can see those first couple of months, it was insane, then it settled down, it's kind of leveled off. But the new normal is wildly above where it was before, right? By a factor of 5 probably. And so we're not going back. And so I think what we're going to see is that whole diffusion of innovations model will now apply going forward, because the barriers have been lifted largely. There's still some concerns we're going to talk about in just a moment. But the idea of having, going backwards is probably not the best strategy. So what happened? Well, again, it's just a necessity as the mother of inventions. And as I said a moment ago, is they just did so much more. The acceleration is here. We can flip to the next one. So some stats. I work with, doctors and hospital executives every day. And, I know that people are always wondering, well, what are other people doing? And what's the world like? And, I have my own viewpoint, but what's really happening out there? So I went and looked up some data as I was preparing my side of the presentation today, and there's from a variety of sources. And so the first thing is, these numbers are outstanding, right? Patients being happy about anything, sometimes we think. So 92%, according to NRC, reported positive sentiments around telehealth. 85% thought their provider was attentive and listening, and 60% said it was easy to make the connection. 97%, according to the American Hospital Association, would recommend it when we're satisfied with their first experience. 83% of patients expected to continue using telemedicine after the pandemic, according to Economics. And again, according to the AHA, the American Hospital Association, 63% said no difference in overall quality of care. There's lots more data on that. If you're interested in, I'm happy to email you the stats that we've compiled. We don't have time to share everything today, but there's tons of data on this. So I think it's really super interesting, but that gives you a sense of where it is. Now, remember that whole diffusion of innovations, there's laggards out there that for sure still don't like this idea and want to go back and see the doctor, but there's a whole bunch of people who've already embraced telehealth. And once they've tasted it, it's hard to go backwards. Next slide. By the way, for me personally, I love telehealth. Again, I'm on the innovator side. I was using telehealth before the pandemic. I have all kinds of stories I would love to go into, and I just don't have time, about personally how, instead of going to the urgent care and spending half my day in a place I don't know, I can get telehealth in a matter of minutes, while preparing breakfast. So doctors, right? So doctors matter. What do doctors think? Because if you're the leader of a hospital or practice, you have to get the doctors engaged. Clearly, there needs to be doctors buying in. You may be the doctor yourself personally in a solo practice, or you may be head of a 100 hospital health system, but the doctors are always central to this. So we want to take a look at what the doctors are saying. So again, according to the American Hospital Association, more than 75% of doctors surveyed felt that, and by the way, it's called the Telehealth Impact Physician Survey. You can look that up if you care. But 75% said they were providing quality care through telehealth. 60% went so far as to say it actually improved patient health. Clearly, 80% thought that it improved timeliness of care. And interestingly, according to the MGMA, of the practices who've been tracking their satisfaction with telehealth, they said 61% of those practices said satisfaction actually increased over the past year. So we know that doctors are positive about this. Go ahead to the next slide. One thing that's interesting too, again, is how long most of these doctors we just talked about being surveyed had been using telehealth. And you can see this report was compiled in November of earlier this year. And the vast majority had been less than a year. So really, these are all sort of, COVID technology babies, right? These are new people to telehealth. The vast majority had not used it pre-COVID. Next slide. We're finding that the convenience factor, I think, probably impacts this. As you may know, certainly doctors are doing it at the clinic and hospital, but a huge number, 63%, have done telehealth at home, which again, is just helps the doctors be more satisfied with the service. So as we pivot here, I've talked about, this is a common saying. It's one of my favorites though, because I really do take this to heart. And some of you may know this metaphor, others don't, but essentially what Wayne Gretzky, when asked why he was the greatest hockey player of all time, he said it's simple. Everybody else chases the puck, I chase to where it's going to be. And that's such an amazing concept of, okay, where's the puck going to be? We can see what telehealth is today, but where do we think it's going to be in the future? And so next slide, please. So we're going to talk about that. And I'm going to turn the ball over to Matt in just a moment here. The interesting thing is that when it comes to telehealth, when we ask, or when the AHA asks, what is the barrier to maintaining telehealth? Number one on that list was reimbursements, was by far the biggest thing. Technology challenges was at number two. So that's not surprising to me. And with that, Matt, let's talk about reimbursement. Next slide.
Yeah, absolutely. Thanks, Stewart. So this is obviously the most important question that I think a lot of people have. What is going to happen here with reimbursement? And I mean, I think everybody agrees. Everybody across the board sort of believes that telehealth is going to be here to stay. Will all of the waivers stay in place? No. There's going to come a time where the system will have to be HIPAA compliant. Maybe certain types of things that were allowed, like phone calls, won't be allowed. But I think there is overwhelming bipartisan support for telehealth to continue telehealth. So I think the risk is pretty low that we won't see some sort of major extension this year. And so for a little bit of context, currently Congress passed a number of waivers. These waivers are tied to the public health emergency. The public health emergency continues to be extended by the government or by HHS. And so as long as we have the public health emergency, everything stays in place. So I think Congress is working towards some sort of extension. They're trying to decide what are we going to keep, and MedPAC recently came out and was recommending a 2-year extension So we'll probably see something that will extend telehealth reimbursement for a year or two beyond the public health emergency to properly evaluate what type of impact that's going to have on the HHS budget, which is ultimately the sort of big sticking point here. The budget office has really a gross miscalculation of what they feel telehealth is going to cost the federal government. And some of the estimations have been as high as $500 billion. And just to kind of put that into perspective, the entire HHS budget is probably about $1.3 trillion. So 500 billion from telehealth that probably increases access to care, stops, it hopefully prevents readmittance, hospitalizations, things of that nature. It's a technology. Generally, it can be performed with less overhead. Is it really going to add all this cost? Probably not. But I think the budget office is really the sticking point, as there just is overwhelming support for this. And so that just has to be worked through. So it's likely this year we'll see a 1 to 2 year extension, and then it'll kind of proceed from there.
So taking a look at some of the adoption mistakes, again, going back to some data, next slide. I think what Matt's probably going to speak to this, but certainly we had to have when we jumped into pandemic mode and had to use whatever was available, and the government made these different options available to the public or to the doctors. Everybody just jumped in, but of course that's not an integrated solution, right? We have using FaceTime with a patient. It's not going to integrate with anything. Long term, that's not really the right answer. So go to the next slide. Another thing that I think is mentioned here as well, of course, there's no integration at all. So next slide. So those are the kinds of things that we see, and there's a lot more here. So Matt, can you share with us, in addition to the couple of things I just pointed out, what else is going on? What are the problems that, having worked with so many practices and hospitals, where are the bumps?
Sure. I think that we're seeing a number of health organizations start to think long-term, and they're investing long-term, even though, we still have waivers tied to the public health emergency. We're seeing all the big organizations invest in what their long-term answer to not only telehealth, but what is their digital strategy going to look like over the next decade. And so we're seeing a lot of big organizations invest. So I think that a global event happened. Congress did the right thing. They allowed phone calls. They allowed technology that isn't secure. And, frankly, some, people did what they had to do to stay in business and help people. And so I don't think there's anything wrong with that. But I do think that there's maybe a wait and see. There's people are still continuing to use phone calls. They are continuing to, maybe use video conferencing solutions, use WhatsApp, FaceTime. What are you going to do when that goes away? I mean, I think all the experts agree that will eventually go away. So that's a huge one. And we see a lot of big organizations investing long-term. So I think now is the time to think long-term for your organization. So we kind of touched on this, right? These sort of basic solutions, the point-based solutions, or maybe basic video conferencing solutions. And actually, before the pandemic, I wouldn't, if you have a solution like that, I wouldn't worry too much about it, because I do think that is oftentimes how an organization will dip their toe into this water, right? And so, historically, it's very common that we will be the second or third platform, because you want to use something simple to validate it. And now I think we're at a point where patients expect it. And so, this is a great time to think about, how you're going to move away from some of these basic solutions. Not only that, with the basic solutions, you're definitely missing visits, right? There's software downloads, there's no instant technical support that, a service like Mend would provide. There's no, providers are having to do tech support instead of having a partner do that. So there's no question it's adding costs that can be removed, by choosing the right partner. In terms of reimbursement and why we have this as sort of a common adoption mistake, I think our recommendation would be to, if you're worried about reimbursement, just start working with your payer reps now. Add it to your contracts now. There's nothing stopping you from doing that. It will be in your contract at some point. So, might as well go after it now. And the reason why we suggest that is that we have seen really successful telehealth programs come from states that have terrible telehealth laws. So I don't think that should be a reason to slow your business down, to slow your ability to help people down. Start working with your payer reps, add it to your contracts. You can start thinking long term and sleep well at night on this topic. So we would strongly urge everybody to move in that direction. And then I think the last piece is that the organizations that are really successful, they have leadership that believes in this strategically. They have dedicated resources to execute on that telehealth strategy and to be held accountable. And they have clear plans. And we will, of course, help guide those plans, shape those plans, and help to execute as fast as groups want to go to implement a successful telehealth program. But those are the groups that are really successful. They've put some thought into it, and they know that this is going to be a big part of the future. This is going to be a big part of the future of their business, and they have resources, and they put the time and effort into preparation and planning, and that just plays out in their long-term success.
Excellent, Matt. I love those comments. It was really intriguing. One of the things that I thought was such a cool insight. There's a lot in there. You packed a lot in there, but the idea that, the state laws are one thing, but your negotiations are another. So it's like, it may not be broadly accepted, but if you deal with the state and that you still have reimbursement options, that's terrific. That's really interesting. So speaking of revenue, again, healthcare, there's a million facets to healthcare, but revenue drives everything. Without revenue, there's no healthcare. So what I thought was a really intriguing out of the millions of stats I found and decided to curate which ones to share, I thought this was really intriguing. So again, this was practices actually using telehealth, and how did that impact the bottom line here? And you can see that almost 2/3, like a little 60%-ish or whatever, have found that it actually agreed with improving their financial health. And that, remember, is just in the early stages. So clearly, making the practice successful financially is a big deal, and the doctors agree with that. Next slide. So, going back to and expanding, upon the revenue beyond some of the stuff that Matt just described, let's talk about some other ideas that can help build revenue.
Yeah, absolutely. And I mean, we've been, telehealth was one of the first offerings in our platform. We've been doing it for a long time. There isn't a specialty or a workflow that we have not encountered. And we've seen, a lot of people doing a lot of innovative things over the years. So I definitely think we've got some exciting ideas here to share. I think, first and foremost, before the pandemic, we would typically see groups looking at telehealth as a way to deal with no-shows and late stage cancellations. So by introducing convenience in more options, especially for maybe the appointment types that have higher no-show rates, maybe follow-up visits. I know new patient appointments can have higher no-show rates. Groups will look to target and build a clinical telehealth protocol around some of those appointment types to introduce convenience, and it works. And we have examples of groups that actually saw their no-show rates continue to decline during the pandemic. So it's, I think, very effective. It's got to be safe, and you've got to have the right protocols. And most of the major associations now publish good guidance. So if there's a major association that you belong to, or specific to the specialty of your organization, there's a lot of good guidance out there around what is safe and what works and what has positive outcomes when telehealth is applied. The next is, most of the organizations that we work with are thinking about growth and want to grow the practice. And when you are virtual, you're now statewide. And will that remain? There's waivers around borders and allowing providers to practice across state lines. Will that remain? Who knows? But I think, at least if you look at this from a state perspective, right? If you are virtual, you can now access anybody in the state. And I think we've seen innovative groups also leverage that for new sources of referrals. So for example, getting a follow-up visit done before the patient has actually left the hospital to help the hospital avoid readmissions, but capture that referral before they actually leave the facility, get that patient engaged in care, and hopefully have a more successful outcome there. Working with complementary practices or shelters, we have kiosk workflows, right, where we can actually have a designated machine in a secure area, and maybe a referral from a primary care practice to a behavioral health practice is literally the patient going from one exam room to a telehealth exam room and starting a visit with your organization. And I think, we see a lot from payers where there are gaps in specialists that are available in rural areas. They've got rural patients that have certain needs. And I think more and more payers are looking to make referrals to organizations with robust telehealth offerings to help patients that just don't have access to specialists and other care that they need. Another really interesting one that a lot of people may not have thought of is that it's actually going to be much easier to attract and retain providers. If you really want to grow an organization, sometimes the biggest barrier is being able to hire providers, right? Not, maybe having a demand. I've got too much demand, but attracting and retaining the providers is difficult. Telehealth is not only something that patients are looking for; it's something that providers are looking for. Is providers want the convenience that telehealth offers, and so we've seen groups with really strong telehealth programs actually have a wait list of providers that want to join their organization. So I think that's another interesting sort of side effect from having a really strong telehealth program. But wait, there's more. There's really, I think, I'm kind of joking there, but there really is a lot that people have experienced. And, we've started to hear things from providers like, I don't need an office anymore. And we have large groups that have literally moved away from their physical office spaces. And there is a lot that is possible. And so we really wanted to try and make this valuable today and share a lot of these things that people have done, and really expand everybody's mind towards what telehealth can be, because it's going to be a big part of the future. So, I think a lot of groups do experience a reduction in overhead. We literally have groups that have closed physical spaces that are no longer needed. Or if you want to expand hours, expand your reach, you may not have to sign that 3-year lease. It doesn't take as much staff to support those visits. And so there's definitely a reduction in overhead that helps. For larger groups, and this is one that, we mentioned to people that we're talking to, and this is one they don't always think about, but if you have multiple locations, load balancing across those locations can be very effective. And there's a number of ways to do it. We've seen groups do it just by sort of managing it, or by allowing walk-in visits to happen. So if there's a certain percentage of patients that aren't going to show up today, and you're a medium to large size group, you're going to have providers throughout the day with gaps. And so they will take patients maybe that are in person in a location that is experiencing a surge in demand, and put them in a telehealth room and connect them with a provider that is available and that has a gap. Or we'll see groups allow for virtual walk-ins or on-demand types of visits, and then connect the patients to a provider that has a gap. And we've seen groups get to 95% productivity, and I'm not exaggerating. And I think it's the groups that are willing to innovate and willing to try some of these new workflows. They have very, very positive outcomes from a revenue perspective. And then the last is just being able to do more ad hoc type of work, and be able to make that happen on audio video. So it is HIPAA compliant, it's secure, it's reimbursable, it's high quality. You can see the patient. So if you want to expand hours of care, or using telehealth for on-call, or medication management, prescription refill type of work, to even crisis care type of work. Somebody is having an issue or an episode of some kind, or maybe something more severe. In telehealth, you can just get anywhere immediately with telehealth. And this isn't everything, I think, but we'd be happy to always learn about your organization, and then try and help and make suggestions where we can on what's been successful for other folks. So we wanted to just further demonstrate the power of telehealth through Empower. And this is actually an extremely innovative group in Florida. They were successful in pushing the state of Florida to change their laws several times. So a lot of that work has been done by sort of those early pioneers, and most states support and have reimbursement in place for telehealth. But they were seeing very high no-show rates. You know, nonprofit organization, high no-show rates, started with telehealth, and really moved to a combination of patients coming in person, because in some cases the state of Florida required that. They required one in-person visit a year, so they would have that ability for a patient to come in. The providers were still remote. The providers were always remote. And then they, of course, saw patients at home. So they had a good mix of still in-person telehealth with the patient being at home. And they've seen massive reductions in their no-show rates, to a point where they were not sustainable, obviously, at a 50-60% no-show rate. They are far more productive and have reached points of sustainability, and have been able to leverage some of those resources to help more and more people. And I think a big issue is that receiving a referral and then having a large wait time to get that patient enrolled into the practice, and maybe not being able to help that person. Having a telehealth program, having a provider wait list, they were able to attract and retain their providers, and move those referrals a lot quicker, and help these patients get care, and really drastically shorten those wait times. And there were numerous other benefits. They closed brick and mortar locations, and saw many of the other benefits that we've already discussed. But it's just, I think it's powerful what you can do. You don't have to take it as far as Empower. Empower literally moved to 95% virtual. But they're even having just a nice mix of virtual and in person is going to do dramatic things for any healthcare organization.
All right, thank you, Matt and Stewart. At this time, Matt and Stewart will be answering some of your questions that you sent during the presentation. Thank you for doing that. So let's see here. First question: why haven't more health systems and individual physicians adopted this means of delivery care into their practice models?
Yes, Stewart, I can take that one.
Yeah, for sure. I think I'm one of the viewers.
I think a lot of groups were, or they had, probably more than we think, had something. A lot of groups were interested in it. It was really just a matter of reimbursement. And some groups went out there and worked with their representatives and got the reimbursement in place, and others did not, but we're just kind of wait and see. I think we're going to see telehealth reimbursement across the country, and we're going to see widespread adoption quickly. So if it's not something that you're taking seriously, I think a significant number of patients are going to seek out practices that have this option in the future, for all sorts of different reasons that we're probably all aware of. And I think even tying into, Stewart, what you do and what's possible now, a digital ad to a patient engagement platform where the call to action is scheduling an appointment. You have that option for in-person and telehealth. I mean, it even changes the digital marketing landscape for organizations that embrace this approach.
Oh, for sure, Matt. And it's funny, two comments on that. One is, for sure, the reimbursement's been a problem. And then also, I think it's just inertia. I mentioned at the opening, doctors in particular, they're busy. They have to keep up with everything. So learning something new isn't exciting to them because they already have to just clinically need to stay up on everything. And, will it work? Will the technology work? Will my patients like it? How do I fit this into my day? All those things were barriers previously. Again, both sides have tasted this now, right? So a lot of doctors have tasted what this is like, and a lot of patients have. So I think that fear of the unknown is gone. The reimbursement issue still is a question mark, but as we've talked earlier, we're hopeful and expecting things will continue to be moving in the right direction there. But I think that inertia and that fear of the unknown is crucial. It was a big barrier. Going forward, in terms of Matt, you mentioned the marketing opportunities. It's such a rich subject. That's a topic for another day on our webinar. It's funny because we'll be writing a blog post about how to market this again in the next week or two. And then we'll be probably doing another webinar with you on that topic to go more into detail. But for sure, there's a million opportunities. I'll just leave it this way, that, and this will be a tease for the article and further discussions, that if you go back to the 4 Ps of marketing, the price, product, place, and promotion, this P impacts almost really all of them. So you're fundamentally changing the product and your offering. It's not just about, fun little promotion. It's a paradigm shift in how you deliver care. Ryan, I actually have a question, Ryan. Can I jump in? Because I think that this will be one that a lot of people have, is, this whole idea of scaling. Like I was looking at some of the comments here, Matt, and you can see there's all kinds of different use cases. And I think, there's for sure there's, private practices trying to figure out how to fit this into their busy day, single solo practices. There's health systems on the line here with hundreds or thousands of doctors. And, without teaching every detail in the couple minutes we have, but are there some basic models do you find like that just tend to work, or is it all just all over the place?
Yeah, no, I think models that work embrace a lot of what is already in place. So, typically there's already an EHR, practice management system. So there's processes for documentation, there's processes for billing. You even have a sort of a standard flow in most medical offices where you come in, you check in, you go back with the nurse for vitals, meet with the doctor, then move on to checkout. So I think that a lot of what we see is scheduled appointments, and we can integrate those so there's no duplicate entry. We can get the reminders and the links out to patients automatically, get them to test their connection, provide them with technical support, all of those things. And then most practices will implement some portion of that in-person workflow. So maybe they will still have an MA, some sort of coordinator, somebody that will greet the patient, make sure we've got all the correct information, everything that we need, paperwork, all of those things. They will then move the visit into a different status of ready for nurse, ready for provider, whatever you want, whatever your process is, we can typically replicate that precisely in a digital environment. So the only difference is you're not moving them from one physical space to another. You're just simply moving them virtually through a lot of the existing processes that you have. I'd say the other two really common workflows would be some sort of kiosk visit where you do still have the patient in a location, and you want to be able to access a provider anywhere in the organization, or more of an ad hoc, on-demand type of visit. A really abnormal lab result came in, and you've got to connect with this person now. There's maybe some more emergent issue, or there's on call after hours. Maybe there's an issue going on with the prescription. There's a big need for ad hoc, and I would say those are sort of the typical workflows that we'll see for telehealth.
Terrific. Here's another question. There's a lot of states passing sweeping reimbursements, but only for another year or two. What would you say to the organizations that are hesitant to move forward with longer term agreements?
So maybe the payers that are a little hesitant to move forward with longer term agreements. I think it's I think it's sort of unfortunate that the federal government doesn't know what this is going to cost. It seems like they're willing to jump into a lot of other things where we don't know what it's going to cost. But with this being the biggest industry in terms of GDP, this is a great place to keep the economy strong. But I think that's I think the risk is low that telehealth is going away, right? It's very likely we will see a 1 to 2 year extension beyond the public health emergency to just kind of continue to evaluate. The government can evaluate as things progress, and then we'll see something more permanent after that. And if how I sort of think about that and benchmark that for myself, and you can think about this as well. In the United States, the average person is going to the doctor 3 to 4 times a year. We've got 1.4 billion encounters that happen every year. By having telehealth available, are people really going to start going to the doctor's office 7, 8, 6, 7, 8 times a year? I just don't think so. I think the way we receive care, there's a lot of applications for telehealth. I just don't think we're all going to go to the doctors a lot more because telehealth is an option. And I think that's really where fundamentally that's the sticking point at the federal government. It's going to take an extension and then something permanent for it to really be solidified. I still think the right move is thinking long term and getting things in place. And solutions are not as expensive as they used to be. So we're not talking about making huge, I think, financial commitments. I think the cost to integrate is far lower. We've been able to come out with a lot of other innovative options. We work with a lot of nonprofits. We have a lot of innovative options now where we can really bring the cost of the software down. So I don't think it's the same investment today that maybe it once was a few years ago.
Great. JL Try has a good question. Can you explain on some of the ways to avoid no-shows in telehealth system other than sending multiple reminders and pre-billing?
Yeah, I mean, I think a lot of the stick approach of having the penalty, having maybe policies, I don't think that works for most people. I think more and more patients are viewing themselves as customers, and if they don't receive services, they're not going to pay for any services. So I do think it takes a different approach. So appointment reminders are important. We also have AI algorithms that can help assess risk, figure out who is going to show up to appointment, who is higher risk of not attending, and then we can give them more convenient options, right? If we're not sure that you're going to attend this appointment, and there's a number of different ways and factors that we use to determine this. Maybe we give you the ability to confirm. We give you the ability to cancel it, reschedule it. But if we know somebody else is coming in, we do something different. We have different messaging. Telehealth is also a really good option. Again, for appointment types that we know have higher no-show rates, the follow-up visits, the new patient appointment types, and just other types of appointments where we know the no-show rate is high. We can just prescribe telehealth for those types of appointments. That is the option. And you will definitely see a decrease in no-show rates by introducing telehealth. So I think there's a lot of different innovative things you can do besides trying to overbook, besides trying to have a penalty, even just allowing patients to, across the board, reschedule, cancel, confirm their appointments, right? 24/7, 365. We have patient self-scheduling. It's really advanced. It can triage and make all the decisions to get the person into the right appointment type. And I think that type of mindset, that Amazon type of mindset of having your practice be open 24/7, 365, leveraging technology to schedule and allow people to make adjustments. Again, you make it easier for people to tell you that they're not going to come in, and they'll tell you in advance that they're not going to come in, and free that slot up, and that is going to help. So all of these things will chip away, and like I said, we've seen practices that are willing to innovate get to extremely high productivity rates.
Great. Here's another one. When the pandemic started, we adjusted quickly by adopting a cheap and easy to implement solution. How is MEND different?
Yeah, great question. I'll kind of answer this by what everybody wants when they come to us, when they're looking for a long-term solution. What are the things that are really important to everybody? The first is ease of use. They want it to be easy for the patient. In our system, you just click a link, enter your date of birth, you connect. No apps, nothing, works on any device. And you just basically click a link and you connect. It's patented technology that we have. They want it integrated, right? And we can integrate with all the top systems. In a lot of cases, we can get the patient online status in, we can get some sort of launch functionality, get single sign-on set up, sort of playing into that provider staff ease of use, right? Not having staff do a lot of duplicate data entry, working in multiple systems, things of that nature. So we can solve for that. The next is technical support. I think a lot of people, as this monumental shift in an extremely short period of time, as things just moved right into telehealth, providers are finding themselves doing tech support. And that's not a productive use of anybody's time. So I think a lot of these solutions, we provide live instant technical support. Within 20 seconds, we can get somebody on. We run a pre-call check. So every connection is checked, dynamically adjusted. We can do audio fallback. We can detect errors in real time and put the top 3 solutions into the chat for a patient while they're waiting. There's just all of these little details that are going to result in more visits are going to happen when you use a solution that was built for healthcare telehealth visits. A significant percentage of visits will happen if you work with a more professional solution like ours. Then we can, things like digital forms and getting consents and payments and all these other workflows. Just doing the face-to-face encounter isn't the only thing you do on telehealth. Patients at home, we still have to swipe cards, get pictures of insurance, fill out a paperwork for consents or releases or clinical assessments. We can have all of those additional types of workflows and needs built in as well, so that you can do all of the workflows that you need to do, no matter where the patient is located.
Terrific. We got a few more minutes here. I'm gonna see if I can get a couple more in. Can you please cover how prescriptions and diagnosis are ordered in the platform and how those exchanges are brokered to get patients their meds and tests and get the claims billed to their insurance?
Yeah, great question. And really, those processes are not going to change. The only difference, right, is instead of a patient in a physical exam room, they're on a computer screen. And so you're still going to chart in the chart. We don't want part of the chart in our system. We may get some forms for you. We may get some consents. We may get information for you. We're going to move that into the chart. So you're still going to have one chart. And that is where you can prescribe, have e-prescribe, order labs, receive lab results, code and diagnose for billing. All of those processes are going to stay the same. You don't want to move those processes into another system. If you are brand new and in more of a startup phase, you're definitely going to want to have some sort of billing expertise, whether that's through an EHR vendor, a billing company, and you're going to want to have some medical record system that specializes in medical record keeping.
Okay, let's see here. I'm gonna pass it over to Stewart and see if there's any questions that are intriguing to you, and then we can wrap this up here in a few minutes.
Yep. One of the questions was, and this is, I guess, maybe more of a statement. One of the people who asked or have commented they want to share this with their doctors, this recording. And I just wanted to point out to those of you that are listening, that is an awesome idea. Again, if you're in a multi-location business or with multiple providers, trying to get key stakeholders on board, feel free. We'll be getting the recording a little bit later. You can send this recording to whomever you like, the link to it. If you have colleagues who can use it, because I feel like this information is so important. And again, having worked with hospitals and practices for many years, I know getting change is not easy. And so, so the people that are asking about the recording, we're getting tons of questions. Will the recording and slides be available? And the answer is yes, but feel free to distribute it as well. Matt, one of the questions you had, or that we had talked about offline, was about parity between face-to-face visits and telehealth. Do you have any comments on that? Because I think that's important for people to understand.
Yeah, absolutely. And I think, just to touch on reimbursement one more time, I think ultimately, there were a lot of different waivers, maybe over 35 or 40 some odd waivers, but the ones that really matter are the rural restrictions. Medicare restricted patients to be physically located in a rural designated facility that was not a home. Right, so the rural restrictions got lifted, and then the originating site could be the patient's home. And so, what's likely to happen here with parity is another issue. Where are we going to get paid the same, or are we going to get paid less? And so, I think there's a track record that we can look at across all the states. And before the pandemic, there were about 35 to 40 states that did not have any rural restriction, allowed the patient to be at home, and had a payment parity law that had no teeth. So I think if that is a precedent for what we're likely to see, that's probably what is going to happen. Now, why don't the parity laws have any teeth? And what do I mean by that? What I mean by that is that the payers, the employers, they want to have the flexibility in their contracts to pay more, to pay less, and to set those rates with each individual organization. And so I think there won't be a lot of teeth in the parity laws. However, we have always seen people get reimbursed 100% for audio, video connections. And so while I wouldn't expect anything crazy from Congress, I do think that reimbursement rates are will be, if not at the 100% rate, I mean it'll be close enough to still be a very strong option, and the demand is going to be there from patients. So that's what I would kind of expect to see in terms of a payment parity. And that's, again, why we say everybody has the power today to decide their own future, and you can start working with the payer representatives today, work on your contracts, and you can decide if you are going to get paid less, get paid more, get paid the same. And with that, I think, there are some groups that are recommending phone options, audio only options. So it is possible we could see something there, but those visits will definitely be reimbursed at significantly lower rates.
Got it. In the sake of time, I'll take one more question, and we'll field one more question because I think it's a pretty broad one. There's a bunch of other questions that we will email you back, or Ryan and Matt will email regarding the telehealth specific ones. And obviously, if you guys have any marketing questions, I can respond to those. But the one that I thought was we can do to close here is from Jennifer. She's asking, do you have a resource for telehealth policy and procedure development? And this one was particularly asking about behavioral health services, but in general, do you help with those kinds of things, or can you point people at least in the right direction as they sort of try to figure these things out internally, process-wise?
Yeah, and I mean, specific to Jennifer's question, we have a lot of behavioral health customers. So if we don't know the specific answer, we can, connect people to get them the answers that they need. But there is actually the Center for Connected Health Policy is a government-funded website, and it's got it's an amazing website because it's going to have all of the key areas by state. Can I prescribe controlled substances? The definition of telehealth. It's going to give you links to the specific statutes if you want to read these things yourself, and they summarize it in a very clear way. So that's the Center for Connected Health Policy. And so as things do evolve with the federal government, they have an email list. They post things out right away if there's any changes or any movement in Congress. So that's a great one. The next area that I would look at is, what is the major association in your given specialty? That association is going to have things like workflows, case studies from members, billing, specific billing codes, anything specific to the specialty in general, clinical protocols, sort of how people, stood this up and what they implemented, exactly how they implemented. I think you're going to be able to go into a lot of detail by sort of looking at the major associations in any given specialty. They're going to have a tremendous amount of detail about telehealth that wasn't there a year ago. They're going to have it all about on telehealth now. So that's where I would look.
All right. Well, we are a little over time. Thank you, Matt and Stewart, for providing additional insights and for your time. Great presentation. It was definitely a pleasure to have you both. So this is going to conclude our webinar. Thank you, everyone, for attending. We hope that you found this presentation to be of value. Be sure to watch your inboxes we'll send you all the presentation, additional resources, and upcoming healthcare related webinars. So thank you, everybody. Thanks, you guys.